Hi everyone, Serena here. I'm a marketing assistant at Shore Solutions, and in today's video we are going to be answering the question, what can you do to help prevent the exposure to COVID and keep your practice safe when things begin to open back up? So we know that businesses may be opening back up again, some sooner than others, but whatever that timeline looks for your individual practice, there's certain front desk procedures that we would highly recommend implementing when things do begin to reopen. First off, we would recommend that you require patients to call in ahead of time. No walk-ins. This way, when people call, you can screen them and ask them these 4 specific questions to help determine whether or not they could possibly have COVID. Question number 1 that you want to ask when people call in for care is, do you have fever? Do you have sore throat, cough, difficulty breathing, any of these COVID-related symptoms? You just want to kind of gauge to see if they've experienced any of that recently. Question number 2, have you come in contact recently with anyone who either has COVID or possibly could be suspected of having COVID? Question number 3, do you live in a community that has a sustained transmission of COVID currently? And question number 4, have you traveled within the last 14 days? So these 4 questions are what you're going to want to ask people who call into your office for care. And depending on what they answer, if they answer yes to question number 1, as well as any of questions number 2 through 4, there's certain measures you're going to want to take and certain details that you're going to want to do, and we'll touch more on that in our next video. But as for another example as to how you can help prevent COVID in your clinic, is that you're going to want to reinforce policies, of course, that employees stay home if they are sick at all. Do not bring that into the office, especially if you're experiencing any symptoms that are COVID related, like if you're coughing, if you have any difficulty breathing, you do not want to bring this into the office. And last but not least, another thing that you can be doing to help stop the spread of COVID is consider offering telemedicine services to your patients. This is something that will help with social distancing, but it'll still help provide that option to patients if they need it for care. And so I would highly recommend that as well. So 2 situations to this. Let's say they answered yes to question 1 and they are mildly symptomatic. They should not come into your office. I think that's a given, but you cannot have anyone, even with mild symptoms, be coming into your practice. Even though businesses will be opening back up, we still want to keep each other safe and do everything in our capabilities to stop and prevent COVID from happening. And so we cannot be too cautious. If they have mild symptoms, if they said yes to question number 1, they cannot come into your clinic. On the other hand, if they are asymptomatic, so they answered no to question number 1, however they answered yes to any of questions 2 through 4, then they should be self-monitoring themselves, keeping an eye on the situation and practicing social distancing and isolating themselves for 14 days since their potential exposure. Within that time frame, if they do develop any symptoms, they need to be isolating themselves, not coming into any kind of contact with anyone else. And if they have not experienced any of those symptoms after 14 days, then they can resume regular daily activities. That's just something that, of course, everyone should be keeping an eye on. And so I hope that helps. Thank you, everyone. I hope everyone is staying safe, staying well, and I will talk to you soon.